Hello, and welcome to Laudio's four-part webcast series, Fostering Calm and Civility in Times of Crisis. Leading the conversation with me today is Dr. Cynthia Clark. Cindy has been a nurse for more than 35 years. She's the Strategic Nursing Advisor for ATI Nursing Education and a contributor to Laudio's Frontline Community. Cindy is Professor Emeritus, founder of Civility Matters, the author of Creating and Sustaining Civility in Nursing Education, and an international expert in fostering civility and healthy work environments. Cindy, it's so great to have you here with us. Let me start by asking you why the topic of fostering calm and civility is so important at this time in healthcare.
Thank you, Tom. First, let me say how honored I am to be part of this impressive Laudio series, especially during COVID-19. And I would also like to extend my sincere and heartfelt gratitude to all the nurses in the United States and around the globe for all their amazing contributions and personal sacrifices they're making every moment of every day, often putting themselves in jeopardy to protect and care for the rest of us. So it's fitting that we celebrate our courageous and compassionate nursing workforce during International Nurses Week and during the Year of the Nurse and Midwife. So Tom, thanks for the question about why the topic of fostering calm and civility is so important during this time in healthcare. And as you might imagine, the topic is always important, but especially now during this very unpredictable time. Because the consequences of workplace incivility and other related aggressive behaviors, say like bullying and mobbing, the impact is well documented. And these negative behaviors have a significant impact on the work life of nurses and other healthcare professionals, as well as patients and their families. So when experienced in the patient care areas, uncivil encounters can provoke a lot of uncertainty, self-doubt, it weakens our confidence, and ultimately it jeopardizes patient safety. And in some cases, incivility can lead to life-threatening mistakes, preventable complications, harm, even death to a patient. So obviously, this is a very important issue and an essential topic for conversation.
Let's talk more about incivility and civility and compare these two across the spectrum. First, let's look at incivility. What is it and its impact on individuals, teams, and organizations and patient care? Can you give us some examples?
Absolutely. So workplace incivility is often defined as a range of behaviors, typically more lower intensity acts of aggression, many of which can cause psychological and physiological distress for the people involved. And when we don't address it, it can spiral into worse behaviors or unsafe behaviors or threatening situations. So acts of incivility, some examples could include things that are nonverbal, like let's say eye rolling or refusing to listen to a colleague or just simply walking away. It can also be more overt kinds of behaviors like making rude comments or belittling remarks or intentionally excluding others. And it also includes failing to act when actions are warranted, like withholding important information about a patient's care, or refusing to assist a colleague, or standing by silently and not helping when somebody, maybe a colleague, is being treated in ways that aren't so good or so respectful. So in other words, incivility includes not only what we do, but what we don't do to intervene when it occurs, especially when patient safety might be at risk.
Can you describe the link between stress and incivility?
Yes. This association, this relationship is well documented, and we know that heightened levels of stress is related to incivility. So increased stress levels, rising tensions, short tempers can lead to uncivil acts. So what I'd like to do is ask our viewers 3 related questions. And I want them to answer each question silently, but as candidly and as honestly as you possibly can. So here's the first question. Overall, would you describe yourself as a civil, respectful person? Overall, would you describe yourself as a civil, respectful person? And if you're like most of us, you said, yep, that's me. I'm pretty civil. I'm generally respectful. Which leads to the second question. Second question, have you ever behaved in ways that might be described as rude or disrespectful or not so nice? And if we're truthful with ourselves, we say, yes, I have done that. I have behaved in ways that I might not otherwise behave. Which leads to the third and culminating question. Why would an otherwise civil person sometimes behave rudely or disrespectfully? And if you said it's often because we're stressed, you would be spot on. Now, there are other reasons for us behaving in ways that aren't so desirable and might be considered disrespectful. But when we are highly stressed, we know that there is a connection between stress and incivility. So, no matter how we measure it, quantitatively, qualitatively, multiple methods, biomarker studies, the relationship between stress and incivility is undeniable. So, I believe, therefore, we must have a good understanding of this connection so that we can implement some strategies, both individually and organizationally, to mitigate that connection.
So as we think about the other side of the spectrum, then what is civility and why is it particularly important at this time?
Great question. And so I'd like to think about this part of the discussion and start it by saying that civility ultimately is a choice. So this is a decision that we make every single day with every single encounter. Now, we may not have a lot of choice about certain changes in our lives and in our workspaces. We certainly didn't have a choice about the pandemic. Here it is, front and center. But what we do have a choice about is how we respond, how we interact, how we behave with one another. So when we think about what is civility, it really is a genuine respect and regard for others' dignity, perspectives, well-being. And I will also add, it's not only our respect for others, but respect for ourselves, that self-respect that we attain. Civility requires time, it requires engagement, it requires us to be present. And so when we think about that, I also encourage us not to forget about the fundamentals of civility. Things like showing warmth as well as competence, things like please, thank you, and sometimes remembering to thank people for the things that we often take for granted. And to apologize when the situation calls for it. And so those very fundamental and basic kindnesses, I think, can really infuse a lot of civility into a workspace.
Thinking about that then too, just specifically for nurses and perhaps nurse managers, are there some techniques that they can use in the moment to promote civility and maintain resiliency to help both their teams and themselves?
Sure. I'd like to offer a couple of strategies. And what I like about them is you can do them in the moment. They're ready to use. They take practice, of course. But I want to start with cognitive behavioral therapy. And while that sounds like a mouthful, really what cognitive behavioral therapy is it's one of our most evidence-based and effective approaches for dealing with stress and anxiety, mild to moderate depressive symptoms. In its simplest terms, Cognitive behavioral therapy means that our thoughts influence our feelings influence our behaviors, and our behaviors influence our thoughts. So if you're going to use this technique, I'll give you a couple of suggestions. First of all, when we feel negative or intrusive or sort of harmful, overwhelming thoughts coming into our head, we might want to replace that with an image initially. So think of an image that works for you. It might be the off switch on a TV remote. It might be a stop sign. It might be a red light. It might be Control-Alt-Delete on our computers if we're PC users, which, as we know, is a combination to reboot or reset. So as those thoughts come in, bring in that image, take a couple of cleansing breaths, and then replace that image with something else, something pleasant for you, whatever that is for you. Maybe it's your child, your grandchild, maybe it's making the summit on the top of a peak, maybe it's a sandy beach. Whatever that is, bring that into your head and replace those negative thoughts. Now, another way to use this, and this is the way I often use it, is when I feel myself really stressed out or having those kinds of thoughts coming into my head, I ask myself a question, silently ask myself a question. So you might do that as you think about your colleagues, especially under stressful situations, before having a conversation, to say something like to yourself, what might it be like for my colleague right now? What might they be experiencing or going through? And then that puts us into a much more collegial state of mind to act with some empathy and goodwill. I'd like to make a couple other suggestions, and I think probably our viewers use a lot of self-affirmations or words. Sometimes they're even called mantras, but something that we put in our heads that help us through difficult times. So I'll just offer a couple of those. One might be something like this: today will surely bring on some new challenges and some unexpected wins. I'm ready for both. I can get through these tough times because, you know what? I've done it before. Or we are creating new best practices that will revolutionize nursing and nursing practice. So things like that. I'd like to offer a couple of other things because we've heard a lot about the need to build resilience. So we say, okay, what is resilience and how do we do that? So generally speaking, resilience is our ability to overcome challenges and to adapt well in the face of adversity or trauma or stress. It's our ability to bounce back from those challenging situations. And one very power-packed way to build resilience is to practice mindfulness. And you say, okay, what is mindfulness? And that is that state of really paying attention to the present, to be alert to our surroundings and our environment. It's being in the moment, being cognizant of what's happening in the here and now, our external world, our internal world. So I want to give you just a couple of ways that you can do that anywhere, anytime, and it takes less than 30 seconds, 1 minute. So you can use this in your workplaces and at home, wherever. And the first one is just being mindful of our breathing. You know, throughout the day, just pause for a moment and take those slow, deep breaths through our nose and exhaling through our mouths, and really focus on our breath and our breathing and notice the sensations of our lungs filling. This can really, in just a very short amount of time, clear our mind and relax so that we can go back into that patient care space and do the work that we do. The last one has to do with mindful hand washing. And hand washing is an impressive mindful activity now, really now and forever. It's very uncomplicated and it can be done alone. We can do it at home with our children. We can certainly do it in the patient care areas. So that mindful activity of washing our hands, being aware of the temperature of the water, the feel of the friction between our fingers rubbing against each other, feeling the sensation of our hands moving along our wrists and forearms, the suds washing away as we rinse, all of those are great sensations to just put us in that mindful place. So Tom, those are just a few helpful strategies that we might use to build resilience during our workday and beyond.
Thanks so much for your thoughts, Cindy. The next time, we'll be talking with Cindy about healthy work environments and what they look like. Thank you.